Hi everyone, my name is Coutinho, and today I'm really excited. I'm not going to talk about sleep or anything like that. We're not going to go into any scientific data and talk about disease. But the gentleman I have with you right now, I'm meeting him for the first time, Dr. Vinay Deshmane. I've heard about him for the last 9 years because we've shared common patients. You know, he does oncology. He's an oncosurgeon specializing in breast cancer, molecular research, and we've shared patients, heard about him every time from my patients. I had so many stories where I remember this 83-year-old lady who came back once after her surgery and she sat with me and she was crying and she was just like, I said, what happened to you? She said, Luke, Dr. Vinay gave me 45 minutes and heard me out, and that is my healing. And when I heard that, because we had common patients, you know, the patients would say, yes, doctor told me to improve my sleep. He told me to eat well. He spoke about moderation. He spoke about the importance of physical movement, rest, and everything else. And it's amazing today to see and to have doctor with us. It's honestly a privilege because in today's world, it's very rare to find people who talk about, you know, just beyond the symptom and integrate lifestyle and everything else. So doctor, thank you for making time. You know, I'm not going to talk anymore, but through your experience of 35 plus years, if you could, you know, tell us how you see and why you started to see the importance of lifestyle, sleep, nutrition, exercise, stress in your practice. That would inspire all of our viewers, because I know we have viewers right now who have probably given up, lost hope in palliative care, and they think there's nothing beyond medicine now that we can do. So please inspire all of us with your experience over the years.
Luke, it's a pleasure to be with you and to speak to your uh, audience. Cancer, well, my journey with cancer has evolved over the last 30, 40 years. And what we realize is that all medicines do plateau in their benefits. But what we need to keep is the thought process that everything is holistic. And medicine has its place, and the general well-being of an individual is dependent on many factors, the mind as well as the body, and both have to be kept healthy. So one needs to work towards that, and it's a very simple system where take as much help as you can get from an allopathic or other systems of medicine, and help yourself by leading a good lifestyle, eating sensibly, keeping a good balance, and keeping your mind content.
Perfect, doctor. So what do you think, since you've done molecular research, and we were having a cup of tea earlier and speaking about research, you spoke about the ability of cells to grow, reproduce, and they respond to certain environmental factors like lifestyle. So what would your advice, you know, like what are some of these things that can affect the normal healthy growth of cells, you know, in a cancer patient or people without cancer as well?
Yeah, we've learned a lot about cancer. No one knows exactly what causes cancer, but cancer is basically a cellular problem. Normally your cells will grow, they have their own cycle, they will grow, multiply, do their job and die. What happens in cancer that the cells stop dying? And this is because there's a software problem in the cells. The cells which normally would multiply and die stop dying, they become immortal. And we have mechanisms which prevent this from happening. We have some genes which will prevent these problems from occurring. We call them gatekeepers. There are some which are caretakers, so if something goes wrong, these genes will clean up the mess. And we also have, very importantly, something called landscaping genes, which keep the environment in your body non-conducive to cancer development. And that's where your lifestyle, the type of food you eat, your psychosocial or mental status makes a difference to all these gene expressions. And this is what could prevent, or even if cancer is formed in the body, keep it in check by keeping the overall internal environment non-conducive to development and spread.
Doctor, a lot of your patients who we help with their lifestyle would come and say after a meeting with you that we have so much more hope after we met you. Over the years, how have you instilled this hope in them? Because a lot of them were aggressive, fourth stage, you know, invasive carcinomas, all of that stuff. But they all came back with that hope. And that's why people, you know, kept coming back to you and telling us these stories. So, because you have so many years of experience, how do you instill hope into people who have given up, or there may be people on palliative right now because medicine's not working, but there's always something that can be done. And of course, there's destiny, which we're not in control of. So I would love to hear that from you.
See, every individual is different. Every individual's problems are different. And when you start talking to that individual, the whole idea in medicine is not just treating with drugs. You also have to treat the mind. And as I said, each individual is different. So a part of your consultation is actually looking for the stresses and trying to see in that particular individual how you try to get rid of these stresses. Right. And one of the things that you need to do is to talk. You need to communicate with the patient. Also pick up subtle signs. You can see it from their face, you can see it from their body language. So you need to pick up all these things. Once you've done that, you communicate with them. Try and see the holistic side of life in general. What's the meaning of life? You try and get into a little bit of philosophy. Everyone's not conducive. So you have to see the ones who will be willing to accept this. And with them, you try and discuss these things. You may not be successful in everyone, but Absolutely. You need to attempt it. Yeah. And at the end of everything, all of us only have hope.
Absolutely.
You and me also only have hope.
We have
and
just
that's
hope.
all that we can really live with in life.
Right.
We can't control everything, and I think that's the most important thing, is that no doctor can control everything.
And no one can.
No one can control it. So once you realize that, it's...
We accept what we can, let go of what we cannot control. So doctor, I'm not going to take any more of your time, but any words of advice to our audience out there? I mean, I know breast cancer is your specialty. So any words of advice from your practice that you would want to give the audience out there, from a preventive measure, from a curative measure, any words of advice?
There is no particular way in which you can prevent any problem from happening, but you can work towards it by having a generally good lifestyle, not putting on weight, exercising, being sensible with your diet. We know certain things cause cancers. So tobacco-related diseases, nearly 40% of cancer are tobacco-related. Another 15 to 20% are obesity and diet-related. And another 10 to 15% are infections. So cleanliness, hygiene, having a good work-life balance, sleeping properly, eating well, avoiding tobacco, avoiding excess alcohol, avoiding smoked foods or a lot of preservatives. These are sort of sensible things that one can practice. And I think the single most important thing is to control stress in some way or the other. We all are stressed, and the stress should not just be excessive. And control stress, and I think that we try and be content in life. I think that's what I would suggest.
Thank you so much, doctor.
And if you have a problem, then do not wait on it. Do see your family doctor. I always say, wait for a couple of weeks. Most problems will sort themselves out. If they don't sort themselves out, you need to go to a doctor and get it evaluated. Don't wait.
I think early detection is playing a huge role in the possible recovery, right?
Early detection is extremely important. It increases cure rates. It decreases the morbidity or the side effects of treatment. Treatments are shorter. Cost of treatment is far less. And the whole aim of our treatments is that someone should return back to a normal life. So the whole aim is catch it early, treat it effectively, and get back into life and lead a normal life.
Doctor, thank you so much for your time. And thank you for keeping it simple, real, and honest. That's what I really appreciate about you. Thank you for the amazing work that you're doing. Really appreciate it.
Thank you.
Thank you.